For the longest time, the Democratic Party was dramatically unhappy with Joe Biden, and the name that was floated to replace Joe Biden was Andrew Cuomo, governor of New York. Cuomo would basically been similar in regards to temperament as one Joe Biden, and so for many Democrats, they were perfectly okay with bringing in Cuomo as if he was in some way a success story. Cuomo had like 30,000 deaths on his back in New York, meaning he was responsible for those deaths because he was governor of that state. Now, despite being responsible for tens of thousands of deaths because of the policies that he enacted, keep in mind, Cuomo made the choice that nursing homes had to take people or patients, whether they had COVID or not. He also put through a provision that would protect those nursing homes from any kind of litigation against deaths and disease in those homes if they pertain to COVID-19. Now, 42% of all of the COVID deaths have taken place in 0.1% of the nursing home population, be it people who are working at those nursing homes or the patients themselves that have various comorbidities that make them just so happen that much more susceptible to death or to permanent illness. Cuomo did this. That doesn't stop Cuomo from coming out and saying things like this.
A phased reopening is better than reopening and closing. That is not just a premise. It's been proven by the past experience. Look at the states that reopened recklessly and are now closing again. Who did that help? It actually set us back. So, Mr. President, don't be a co-conspirator of COVID. Do one simple thing. Acknowledge to the American people that COVID exists.
I don't think Trump has denied the existence of COVID-19. The problem has been more than anything else that Trump has just been so incompetent. He's focused the priority on the economy as opposed to human beings. So from his standpoint, the rationality that he's looking at is that if the economy had been running, the public is going to ignore the fact that nearly 300,000 people have died as a result of my incompetence. That's the gamble that he's taken. That's the bet that he's making. He's assuming that there's going to be a V curve where the economy just kicks back on like a light switch. I don't think that's going to happen. And even if that did happen, I am dramatically uncertain if the public, who basically was for Trump at one point, will give him a pass on that many people losing their life as a result of his actions. But let's be clear, sir. You are also responsible for like 30,000 people croaking. It was directly responsible to your actions. So the notion that you would get out here and say anything in regards to pointing at Donald Trump is appalling. It's appalling as an understatement. Nevertheless, Cuomo continues to run his mouth. Here's the thing. Andrew Cuomo works on CNN. It's Chris Cuomo's brother. Andrew Cuomo ended up with COVID-19 and was doing the show for a while in his basement. Not to mention, he said he fell down, chipped a tooth because his fever was so high, saw his dad, all of those things. So he has a first-hand experience with the issue of COVID-19. And he himself is flipping out. I'm going to show you what he chose to flip out over and what he chose to give a complete and utter pass to. Welcome to the soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. Guys, if you dig this content, please like, share, and of course subscribe. You can always support this content through PayPal or Patreon. This content is brought to you by you, and I appreciate you the opportunity for allowing me to do the news. I found this clip angering and hilarious at the same time in an odd way. The first clip you saw was from like July 2nd, so it's recent. Here's one from a few days ago.
What we went through and what we did was historic because we did tame the beast. We did turn the corner. We did plateau that mountain. And then we came down the other side. And they will be talking about what we did for decades to come.
That is indeed true, but not necessarily for the reason that you are giving. To put this in perspective, this is the United States. Now, U.S., 935 deaths 2 days ago. Yesterday, we had over 1,000 deaths. These are back to the numbers that were there prior, where we were hitting like 1,000 or 900 back to back to back to back to back. These numbers are only going up as the cases will go up, and it is infinitely foreseeable. If you have a uptick in cases, just based on percentages of probability, you're going to end up with an uptick in the number of deaths, whether or not those deaths reach the levels that they were before. You must understand that people have gotten better at treating this illness with multiple other avenues of treatment. So it's foreseeable that the number and the death toll would go down by some amount. Now the catch becomes, what is that amount? Is it moderate or is it more significant? Either way, probability-wise, you will see a percentage just because of the uptick in the amount of people who are getting sick. But yesterday, over 1,001. Day before that, 935. He said it's going to be historic. It will be historic, yes, but not for the reasons that you're giving. This is not going to be historic because you did something awesome in regards to stopping the virus. If you're looking at New York is still number one for the number of deaths, 32,495. In regards to cases, 430,277. Cuomo was asked one day, how do you sleep? Meaning, do you feel that you've done everything that you can to preserve life or limb? He says, yeah, I sleep well because I think nobody died that should not have died. Well, that's belied by actual evidence and data. So right here, in cities where the virus arrived early and spread quickly, those actions were too late to avoid calamity. In New York metro area alone, 21,000 people, 800 died by May 3rd. Fewer than 4,300 would have died by then if control measures had been put in place and adopted nationwide just a week earlier on March 8th, the research estimated. Meaning Cuomo shut things down. So right here, on March 16th, Mr. Trump urged Americans to limit travel, avoid groups, and stay at home for schools. De Blasio and New York City closed its school system on March 15th, and Andrew Cuomo issued a stay-at-home order that took effect on March 22nd. Their point is, if you would have done this a week earlier, March 8th, you would have saved, what, almost 20,000 people? That's the point that they're trying to make. This wasn't a situation where Cuomo did a great job. It was the opposite of that. Cuomo got tens of thousands of people killed. Here's the catch. When Cuomo went on to discuss
Video come out.
with his brother, Cuomo, his brother, this is what them two talked about. Again, like 20,000 deaths that didn't have to take place, took place in New York because of Andrew Cuomo and his leadership. Let's hear newsman Chris Cuomo get in his ass about it.
Before we go to break, where you wanted to encourage people to get tested, and some people are afraid it's going to hurt. So you had video of it that I want to show the audience of you actually getting tested. Here it is. There's you were kind of funny, and they were testing you. Now, a few questions about this process. First of all, is it true that when you were having the test administered, you inhaled and the doctor's finger went all the way up your nose and got stuck and had to be released with a tool? Is that true? Just to deal with the record.
She wanted to comment that I have a little button nose, and she was afraid that the swab would actually hurt because it extended my nasal cavity.
The proboscis
she was
issue.
speaking about the delicacy of
the nose. And that's what, you know what, I understand. This is the normal swab I'm holding up here now, and for everybody at home. A very valuable object. There's only one company in the entire country that makes these up in Maine. All right, here's the swab. Is it true that this was the swab that the nurse was actually using on you, and that at first it went into your...
20,000 people dead. 20,000 people dead. 20K more than what would have taken place if he would have done his job with due diligence. And this is the conversation you're going to have with him. Now, this didn't necessarily get under Chris Cuomo's skin, but this did. This took place like yesterday, where he drops the S-bomb on network television.
Let's start with this.
The pandemic is in full effect. It's feasting on us, especially red states whose governors followed Trump's trail of denial to their own detriment. Now, why should you be hot? Why should you not believe? Well, the record. But more importantly, this. You tell me how a president in the middle of a pandemic has got time for this bullshit. Are you kidding me? Hawking products at Goya, I don't care who it is. Resolute desk. This is what he's resolute about. Pandemic priorities. His daughter Ivanka, top White House advisor. Are you kidding me?
Are you kidding me? Are you just kidding me? Are you kidding me? Now, 10,000 deaths. Put that in perspective. He's yelling at the president of the United States because all of these people died. 100 and nearly 40,000. We'd be lucky if we get out of with 200,000 people dead going into August and September. But you were talking with your brother in this buddy-buddy fashion when it was clear that your brother was responsible for nearly 20,000 deaths. He reacted too early. He hid and tried to cover the nursing homes from the litigation standpoint. He made certain decisions that were erroneous, that it caused the life of a lot of people. And you have this bullshit conversation with your brother, but you flip out over the Goya products. Look, the Goya products on Trump's desk is horrendous. It's utterly ridiculous in a thousand different ways. I'm just trying to point out that if you're angry at Trump for getting all of those people killed while simultaneously doing this other stuff with a misdirection in regards to priorities, what were your priorities when you had your brother on the show and studies were out showing that nearly 10,000 people or 20,000 people would have survived if not for your brother's behavior? Meaning, if you would have did something else. I'm just saying, I understand the righteous indignation at the health food products and dropping the bullshit. I don't understand how you give your brother a pass when your brother is responsible for nearly 20,000 deaths. That's all. I appreciate the righteous indignation on this, but that righteous indignation should also be there when you're talking to your brother, considering that your brother was infinitely culpable for tens of thousands of people losing their lives. That's all. Appreciate the righteous indignation. Bilal Salam. Bilal Salam. Jamal, thanks for the content. Do you think there will be another spike in the greater New York area? So that's the interesting thing. I'm not sure. New York is such a packed and dense city, and because it's such a packed and dense city, it's people are in close quarters with one another. Now, if those people are taking certain actions in order to try to prevent and to push that down, the answer may end up being no. The problem is New York is such a big city and you have people traveling to New York all the time. So just because somebody in New York may have the social distancing thing, it doesn't necessarily stop somebody else or people coming into New York that don't get it on a flesh to bone way that New York has gotten it, that may potentially cause an uptick or spike. So there's no way to entirely know whether the metro or the city of New York will deal with a spike. But considering Florida, Arizona, Texas, I think it's 41 out of the 50 states are experiencing some kind of increase either in the number of people who are infected, who are experiencing a percentage in the infected rate. Meaning it's one thing to say, okay, we're doing 10 million more tests per day. But if you're looking at the rate of people who are being infected or the positivity rate, that number is immaterial in regards to the number of people being tested. It doesn't care. If that number is high, that number is an indication that you have more and more of your people that are coming down with that particular illness. The argument that Trump is trying to make is basically it's the testing that's causing the spike. The problem is you have Texas and Arizona requesting refrigeration trucks because they have so many deaths that they can't compensate regarding the morgues. So hopefully there's not. Hopefully the 20,000 deaths that Cuomo was responsible for is the end all and be all of the calamity. But unfortunately, there's no way to know. And the moment that you loosen the restrictions, thinking that, all right, this is over with, it can come roaring back. I'll tell you like this. I was in a hospital and well, I spent like 10 years in the hospital. But in one of the particular moments in the hospital, it was around Christmas. And my mom bought me a video game so I could play in the hospital. At the time, I think it was a Nintendo something. And so I couldn't do anything else. I had been in the hospital for a few months, and I had no intention of going anywhere because my doctor was outright against it. I caught an infection while I was in the hospital. Now, the infection didn't have any antibiotics to do anything to deal with infection, meaning the class of antibiotics that you would typically use weren't working for the infection. It was at that point become antibiotic resistance. Sorry. It was a superbug. They had two options. They were trying experimental drugs, or they could have tried to just cut the skin off, meaning they would have went through and cutting off areas of the body to try to get rid of that skin or the infected tissue. If the infection didn't work, or if the antibiotics didn't work. There was like 2 infectious disease specialist doctors in the entire area. And those guys basically worked almost around the clock. And he did not want me to go home at all. And it became this really big issue that I wanted to go home before New Year's. He didn't want me to go home before New Year's. His thing was, look, this is a bug. This bug is not necessarily entirely under control. Your body temperature and everything else is still remaining high, even though it may not be at its worst. You should stay here. Now, he would have probably made the point that if you end this regimen too soon, this thing is going to come back. And in the same way we didn't have any drugs to treat it before, it is possible that when it comes back, it mutates in a way that is resistant to the drugs that we actually did use, meaning this could get worse. These things mutate, and these things sometimes take different forms, and sometimes they linger around. And you take your foot off the gas too soon, and they come roaring back with a different level of ferocity, especially if there's any level of, let's say, reproduction to be resistant to the drugs or to whatever treatments you're using in order to deal with the virus. So it's possible. Not to mention the immunity doesn't necessarily seem to last all that long, maybe a few months at the most. Let's hope for the best to say no, but do we know it? We do not. I'll leave it here. Like, share, subscribe.